My name's Rachel and I'm an occupational therapist at City Hospice. Today I'm going to go through some basic breathing techniques to help with the management of breathlessness. Breathlessness can be a very frightening experience, both for you and for those around you. It can limit your participation in activities, increase levels of fatigue, and also can be very distressing and increase your anxiety levels. Today we're going to go through 3 simple breathing techniques that can be used at any time and in any place. Practice of these techniques will help with your self-management of your breathlessness. The first technique we are going to talk about is controlled breathing. Often when people are breathless, they will revert to a technique of panting. This technique requires the use of a lot of energy, and often patients report that they develop a very dry mouth, which is increasing their discomfort during their breathlessness episodes. The technique that we're going to first talk about is regarding breathing slowly and controlled in through your nose and out through your mouth. Controlled breathing involves gently and calmly breathing in through your nose and out through your mouth. The aim is to limit any movement in the shoulders and to refrain from taking very deep breaths. If you take deep breaths, what may happen is you will actually irregulate your breathing by developing a cough, which I'll quickly demonstrate. Unfortunately, this is quite a common occurrence, and as your breathing is irregulated, then the anxiety can increase. With the calm breathing in through your nose, out through your mouth, you may have previously been advised to breathe in for a count of 3 seconds and out for a count of 6 seconds. Although this is a good method, what we may find is that due to the level of your breathlessness, you may not be able to manage this pace, and that in itself can cause further anxieties. What we would recommend is that instead of using a counting mechanism for controlling that breath in and a longer breath out, is to actually use a visual guide. So if you look around your home, you may find something that's a rectangular shape, such as a television, a picture frame, a mirror, a book, anything of a rectangular shape. And what we're going to do is we're going to use that shape to guide your breathing and give you a point of focus. So if you have a look at this rectangular shape, as we breathe in through our nose, we're going to look from one corner to the next. So it's a nice calm breath in through your nose and out through your mouth. In through your nose, out through your mouth. What you may find, as with many techniques, is initially the journey around this shape might be quite fast if your pace is quite fast, but for each journey it will then slow. So remember, in through your nose, out through your mouth. In through your nose, out through your mouth. This technique is one that is really good to practice when you're not actually experiencing any breathlessness. If you're sat watching the television, you can actually practice this just to get the feeling right so that you feel more confident to incorporate it when you are feeling breathless. The next breathing technique we're going to discuss is diaphragmatic or belly breathing. The diaphragm is a large muscle situated at the base of the lungs. When we inhale, this muscle flattens and contracts, creating a large open space within the chest cavity and creates a vacuum to bring air into the lungs. When we exhale, the muscle returns to its normal shape, and that allows for the air to be pushed out of our lungs. One of the benefits of this breathing technique is that when you place your hands on your abdomen or just above your stomach, you will actually be able to feel and see the movement. This ensures that you know that you are actually engaging your diaphragm during this activity. With this breathing technique, the aim is to keep our chest as still as possible, our shoulders as relaxed as possible, and to rest our hands just below our ribs and between our rib cage and our stomach. As you breathe in through your nose and out through your mouth, you should be able to notice a small movement of your hands coming in and out. We're not expecting a large movement. It is usually a very gentle movement of up and down. Again, just to remind you, we're aiming for the movement down at this level and not up at your chest and your shoulders. So if you just rest your hands casually just by there and breathe in through your nose and out through your mouth. In through your nose and out through your mouth. As you breathe in, you should feel your hands move very slightly out from your body, and as you breathe out, they should relax back down. See if we can demonstrate this. So just resting your hands just by there, and breathe in through your nose Engaging the diaphragm can take a little practice. Again, what we would recommend is that if you are going to use this technique, is to practice it beforehand when you're at rest and not breathless. This will allow your body to get to know how it feels to engage that diaphragm during your breathing exercises. The third breathing technique we're going to discuss is pursed lip breathing. Often when people are breathless, they take shallow breaths. With pursed lip breathing, the aim is to keep the airway to the lungs open for longer. The simple technique is to normally breathe in through your nose and out through your mouth, but when you breathe out, to imagine you're blowing out a candle. So gently breathe in and breathe out. It may actually help you if you do actually pop your finger up as well, because if you blow on your finger, you're also getting sensory feedback as well, which makes you realise how much air you're actually managing to expel. So again, if you just pop your finger up as if it's a candle and breathe in through your nose and blow that candle out. Again, in through your nose and out through your mouth. With each of these techniques, again, we do recommend that you practice them when at rest so that you feel comfortable and be able to utilise them when you feel that you need them.